said, I'm okay with pain.
You're right there.
Nasty.
You're right there.
Are you like scraping me with something?
Just the tool and some. Oh, you're feeling the biofreeze maybe?
No, I'm feeling like a fingernail or something.
This.
Oh, yeah.
So, I'm going to have you go ahead and go face down. We're going to start with an adjustment today. How's your back feeling?
Not bad.
Not bad. Any pain or just stiffness? You know, relax. Let all that tension go. Yeah. Relax. Let it go. Deep breath in. All the way out. Deep breath in. All the way out. Deep breath in, all the way out. Good, one more. Good. All right, so you have about a 1/2 inch short right leg today. So I'm going to go ahead and have you lay on your side facing me over here. How did it feel like as you were working out? Did it hurt your low back at all?
Where? Which part?
Because you didn't feel any discomfort in your low back.
No.
Right? Kind of stiff in your low back today.
Yeah.
Let it go. Oh. Okay, and the other way. Maybe scoot back just a little bit. This is a little stiffer than normal.
Yeah.
Anything else this weekend that would have caused that to get stiffer?
No.
Sitting a lot?
Yes.
I hope you watch some good shows at least.
Computer screen.
Oh, I know that feeling. Come on up. Lay down, let it go. Turn all the way towards me. Look all the way up. Let your head drop to the left. Let it go.
The back is generalized sensitivity.
Got it.
Right, so it's not as like not the trigger points that you will hit when you dig around here,
Mm-hmm.
but it feels like there's more total area
Okay.
that is of, that's very sore back here.
Okay. All right. So, I think I want to start here because, like, I feel like it almost hinders us in our treatment because it is so sensitive. It's so painful to the touch. So we will start with that. Average.
Either that or I just can't handle pain.
No. I think you're pretty stoic. So based off of your skin tone, it uses a different combination of wavelengths, and your skin will accept more or less depending on the correct wavelength that we choose. So we also choose like I chose a chronic protocol, so it's going to be more, it's going to penetrate deeper If I chose more of an acute protocol, it would stay more on the surface trying to flush out fluid that was kind of like on top.
Mm.
So there are 6 different stages or phases, I guess you can say. And each one is going to be shooting out at a different frequency. So you'll hear the machine make different noises during this time. But it damages your retina if you're exposed to light. Alright, so I broke my last pair, so.
It's all good. It doesn't, it's nasty, but it doesn't hurt the worst.
Okay. So which one does hurt the most?
I'm not directly on it, but oof, like right in there.
Okay.
That's crazy town.
Okay.
That's a bad one. Oof, right in there on top.
Okay.
That's a
Alright.
bad one.
I think I'm just gonna do this whole area then.
Okay.
I'll just really zero in on that. So, what I'm probably gonna have you do is lift your arm straight up and down like that, okay? Now, if it feels hot, just say now, and I'll go ahead and move that for you, okay? Go a little higher if you can. Is it getting hot?
Mm-hmm.
Is it too hot?
No.
Okay, just say now as soon as you're like, oop, too hot.
Yeah, no.
I was gonna say that was pretty good.
Do what?
Just rotate your head to the left, but keep going with the arm.
I got you.
Yeah. Yeah, that's brutal. I just feel like there's so much going on with this shoulder that we need a little extra help here. Too hot?
No, my arm's getting tired.
Tired? Okay. We're almost done.
Different
Let's
direction.
go back. Go back. Is that okay?
Yeah. Oof.
What's wrong?
I just felt it in my back.
Careful with the cord, but bring your arm out to the side. Okay. And just lift it like this. Slow, super slow. Keep the muscles engaged back here so we don't overload that shoulder. Let's try this. Just barely, barely. Slow, super slow. You can just relax for this last part. Alright. You are done. Wow, you can really take quite a bit in each spot.
Really?
Yeah, most people, they're very sensitive. So they could maybe do a few seconds. Like 3 to 10 seconds at the most.
That wasn't bad at all.
Yeah, you did great. So, let's try it out. Now that you're done, go ahead. Let's lift the arm up again. Does that feel a little different? Feels exactly the same, feels worse. How would you
It feels less crunchy.
Less crunchy, okay. That's what should happen.
For sure.
So it can penetrate to some areas of the labrum, but not all of it. So we definitely won't be able to fix your whole labrum, but we should be able to at least heal the rotator cuff tendons pretty well, because you're kind of flooding it with oxygen and allowing it to heal much faster.
Yeah, it feels good.
Hopefully it's less sensitive when I touch it, so let's see. Still bad?
I mean, it's not sensitive. I mean, I know it's nasty and that has that like ridge in there, but it's not as sensitive.
Perfect. Yeah, that's much better. So there's still, there's a lot of that called like gobbledygook. It's just really fibrous in here. So we'll probably have to work through that a few times. Yeah, so it's still really bad in this anterior deltoid. And that's that motion. That's why I kept having you do that motion, because it's really sensitive. So we'll just have to keep working through that. And we have already, what have we done to the shoulder? We've cupped it, we've grastoned it, right? We've done all these other things. So this is even after many treatments, it's
Yes.
still like this. Now, I think we've talked about like trying to engage those muscles between your shoulder blades a little bit more. How is that going?
Well, I thought I was doing fine till you were just like push that back, and I felt like I was doing something completely wrong.
Okay, don't worry. It takes time, but I am, you know, there's still quite a bit of that forward positioning. So we really do want these muscles to engage a little bit more. Okay, try to like actually fire these muscles and let that pull the shoulder back. Just be careful. You don't want to like shove the shoulders back because, you know, we really want to fix this. And if you just shove it back, it's temporary. That's just while you're holding the shoulder there. We really want this to be lasting and have these muscles a little bit stronger.
So how do I do that?
That's a great question. So, probably the best thing you can do is go ahead and stand up. So, how about the glute engagement? Are you pretty good about getting your glutes engaged?
I am now.
Okay.
Well, I'm working on it.
Okay. And how about getting the obliques kind of tucked in? How do you feel with that? We talked about that as well.
I'm not sure I'm following that.
Okay. So if you were to take your elbows out so that your hands are out like this, you're making fists, squeeze your fist and pull down. And you feel the engagement kind of right here on the side, right? We kind of want to tuck our ribs in at the same time that we're pushing our tailbone in and then engaging those muscles in between the shoulder blades. You get what I'm saying? So it should be tuck your tailbone in. You're going to pull the ribs like this, like that, and engage here. And that is like the way that we get perfect posture. Now you should feel some burning, kind of like the muscles are really firing. Where do you feel it? Do you feel it more in the abs, more in the glutes, or more in between the shoulder blades?
Doing what?
Kind of getting those three groups in place. Like activated. Which one feels the hardest? Why don't you try walking and doing all those things? So glutes are engaged, muscles between the shoulder blades are engaged. I'm just going to get a side shot. So go ahead and squeeze your glutes. Relax your glutes. Okay, squeeze your abs, kind of those obliques. Okay, so see that kind of pulls you back. Now the shoulder blades, engage the muscles between the shoulder blades. That's the hardest part for you, right?
Doing the abs and the shoulders together is really hard.
Really hard, okay.
Like that is everything I can think about is to do both of those simultaneously.
Okay. Is one more difficult than the other if you just do them individually?
No, they're pretty similar if they just do one or the other, but together it's like war going on.
You feel more forward or more backwards when you do it?
More forward.
Forward, yeah. So it's just the shoulder blades are not as strong as the abs. All right, so let's dig in. You can't seem to escape the torture on a visit.
It's why I'm here, though.
Come on in. Let's try it again. Does it feel equally challenging on both sides?
What do you mean challenging?
Because like I feel like you actually have atrophy on the whole left side compared to the right. So the right side is much stronger. Like
well, the reason for that is because I was a right-handed ball player. So I've always had an overdeveloped right wing versus my left wing.
Okay. That definitely makes sense.
It's why I've always actually had a little bit of a tilt in my spine because my right side is just more muscular and it sort of pulls me.
Especially right here. Because your low back spine, it's really right here where it picks up.
I'm like a, what do they call it? Stone crabs. I got one big arm and one little arm.
I just realized I still have my laser glasses on.
noticed that, but I wasn't gonna say anything.
Okay. It's pretty bad right there. Bring it across.
Oh, that's gnarly.
Too much?
Whoa. Just giving you feedback that you found a spot.
Oh, it's pretty rough.
Mm-hmm. You found it.
That's a good one.
Ow, ow, ow. Something, I don't know what that was.
Was it shooting down the arm at all?
Yeah.
Yeah. I mean, we're digging in pretty deep.
Like I said, I'm okay with pain.
You're right there.
It's nasty.
You're right there.
Are you like scraping me with something?
Just the tool and some. Oh, you're feeling the biofreeze maybe?
No, I'm feeling like a fingernail or something.
This.
Oh, yeah.
Yeah, it's leaving a indentation in your skin, so it's getting in there. But it actually released it already. It feels a lot better. It's like one little spot though, right there. Try that.
Oh, yeah. Oof. Feels lighter.
Okay, good.
Oh, 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 oh. Oh.
I think that's good for today. What do you think?
Sure.
But that feels pretty loose, right?
That is no joke. That little spot. And that.
I know. I think that's the tough thing with your shoulder. There's just so many different things going on. It just had so much trauma over the years. It just takes time. But within a few weeks, it'll already start to feel pretty normal to do that. Once those muscles start activating, they're just going to be there for you.
Right.
But it's hard to get them awake again. Thanks for watching my channel. Hit that subscribe button below if you would like some very simple, easy tips and tricks on how you can improve your posture. And if you have any questions that maybe you'd like me to make a video about, leave it in the comments below.